so I was involved in the study, the science on root canals in the late 90s. And then in about 2016, my beloved and I decided to seek out the best healthcare in the world, and we found what we found was in Switzerland. At the time, it was Dr. Thomas Rau at the Paracelsus Clinic. I knew about Dr. Rau for many years because he has such an international reputation for being one who can really cure a complex chronic disease. And he also had a dental clinic in his private hospital in Switzerland. So that was a very interesting concept for me to go study in a different country, study what's the magic there to not only healing patients completely, but to involve the mouth in an experience called getting your health back. Because like I said earlier, dentists are trained to be nothing but tooth mechanics. And it's not about the disease. It's about the repair. So here we are learning Swiss biological medicine in Europe. And about the same time, I went through the ACIMD program with Dr. Malika to become a naturopath. So I have 2 medical degrees as a naturopath, but I have a license as a dentist. I'm a dentist. But I really wanted the education, not only inside the US, but outside the US, so that I could really develop what now is called the biodentist way, which is really a protocol that we get the body involved in a dental experience so that we can really mainly do 2 things to, number 1, save the life of a tooth. And number 2, to change the conditions in the body so that when we have this assault on the body called the septic experience, called taking out the dead teeth, okay, which is surgically extracting teeth and the poisons around them that surround the ligament in the jawbone, and including the cavitation sites as well, where teeth were pulled many years ago, typically wisdom teeth. So I built this protocol. And it goes way beyond nutrition. It's really about changing the conditions in the body. And in Swiss biological medicine, it's really about drainage, okay, in many ways. So in 2016, I was really starting to develop the concept around how to get the body involved. So what we have here in Denver now is a separate clinic called BioVital, which is under medical directorship. Okay, it's not under my license; it's under the license of an licensed MD. And we have biodentists here at our location in Denver called the Human Universal Health Institute. It's huhinstitute.com. And so we in home of biodentist and BioVital. So really, it's a biological medical center that's wrapped around a dental experience here. So we work since 2016. We've been developing that, and currently, I'm still practicing dentistry for a little while longer. I'm writing a book right now about this, and it's really going to be a groundbreaking way to bring health and education to the not only the people who are interested in health sovereignty, okay, but really are looking at the conditions in their mouth and really just making the decision. It's like, wow, maybe my mouth is the reason why I'm sick and why I can't get somewhere. So that's really what our work is here in Denver, is to work very closely with a few select people that really want to involve their body and their health in a way that is deeply biological. We're after, building the mouth in such a way where it just is incredibly stable long-term. Teeth are long, sharp, and beautiful and balanced and non-toxic. So, it's quite the journey typically for most patients that work with us. But my goal is to work myself and every other dentist out of a job. So, truly.
Yeah, it's one of the fields that is, when you're one side of the field and you're learning about it, you're in a completely different paradigm than what this is, what biodentistry, what Dr. Rao Huggins and others are doing. And I had Dr. Rao on, I believe his podcast goes live in a couple of days. And a lot of what European biological medicine is about, and what Paracelsus Clinic and what he does with biomedicine is looking at toxic burden and how many people carry such a large toxic burden with them that then relates to infections, but also vice versa.